Everyone, welcome to session 110 of the Behavioral Observations podcast. I'm joined by Rebecca Womack, who's the Director of Clinical Compliance at BlueSprig Autism. She joins me in this session to provide an overview of the importance of pinpointing and analyzing key performance indicators, or KPIs for short. At first glance, this may seem like a topic that is about as exciting as doing your taxes. However, when we dove into this subject, my inner nerd was fully engaged, and I started thinking about how I could use this concept in all aspects of what I do. I guarantee that even if you do not work in an insurance-funded setting, or if you're not in operations management, you'll still find many takeaways from this conversation. During this interview, Rebecca effectively made the case for using a KPI lens in whatever you happen to be doing. And funny enough, after I finished the interview, I found out a little bit later that she was not only battling pneumonia during our conversation, but her husband was texting her with updates from their barn as one of their goats happened to be giving birth during the interview itself. So I appreciated Rebecca's ability to put aside these things and to patiently educate me on this topic. And by the way, if you want to see pictures of said baby goats, go to the show notes of this episode, behavioralobservations.com/session 110. They are awfully cute. All right, we mentioned a handful of resources in this episode, and I've done my best to run down the links to those also at the session notes. And one last thing before we get to the interview itself, I want to let you know that we are brought to you by the following. My friends at FTF Behavioral Consulting are holding a 2-day workshop covering all aspects of practical functional assessment and skills-based treatment. This is formerly known as the ISCA process. It'll be held at the DCU Center on April 16th and 17th in Worcester, Mass. For more information, go to ftfbc.com and click the Events tab. And if you're not in Massachusetts, let's say you're someplace warm like Melbourne, Florida, consider attending the Florida Institute of Technology Behavior Analysis Students Association Annual Conference. This is a full-day, single-track event with just some absolute rock star presenters. So if you want to learn more about that, go to fit.edu/continuing education. This conference will also be available online as well. We are also sponsored by Behavior University. Their mission is to provide university-quality professional development for the busy behavior analyst. Learn more about their CEU offerings and podcast-specific discounts over at behavioruniversity.com/observations. And last but certainly not least, on April 2nd and 3rd, the Verbal Behavior Conference will be going down in Austin, Texas. This event will feature speakers such as David Palmer, Barbara Esk, Pat McGreevy, Mark Sundberg, and more. They've even asked me to moderate a panel at the end of the first day. So if this sounds like fun to you, go to ctac.com/podcast where you can register at a discounted rate. Or again, with all these sponsors, events and things like that, you can just go to the show notes for session 110 and it'll have all the links there. So that does it for opening remarks. So without any further delay, let's get to this fun conversation about KPIs with Rebecca Womack.
Welcome to the Behavioral Observations Podcast, stimulating talk for today's behavior analysts. Now here's your host, Matt Sikoria.
Rebecca Womack, welcome to the Behavioral Observations Podcast. How are you doing today?
I'm doing good. Thank you so much.
Well, thank you for reaching out. You had emailed me and said, hey, I've got a great topic for you to consider, all about KPIs. And my first question was, what's a KPI? And I look forward to kind of getting into that. I should also note that you were very humble and you suggested all sorts of other people to come on the show to talk about this. And I thought to myself, well, you're actually seem to be quite knowledgeable about this. Why don't you just come on and talk about it yourself? And so, here we are a couple months later. So thanks again for joining me today.
No problem. Thank you for having me. I really appreciate the opportunity to chat with you.
It's my pleasure, of course. So let's start the show like we always do here at the Behavioral Observations Podcast. We'll get to KPIs in a minute. Let's first hear about how you got into behavior analysis. So if you can let us know how you first encountered it and how you decide to hey, this is a good career. I want to follow this and so on and so forth. So if you can kind of give us the backstory, that would be a great place to get started with.
Sure. It was, for me, more of a shaping kind of experience versus a direct, like, this is what I want to do. And my first encounter with thinking about this field was when I was in my undergrad program, and there was a gentleman with developmental disabilities who worked in our kitchen. And I befriended him, and he gave me a necklace, and he always remembered like me during special holidays. And I so appreciated that. And I just fell in love with him. And I noticed that he had a staff with him, or a person. I didn't know who this person was. And I asked him, I was like, who are you? And can you tell me a little bit about what you do? And he explained that he was his staff, and this gentleman lived in a group home. And so I applied with that company and ended up working with adults with disabilities in a group home, and an ICF IDD, which I'll explain that in a second. And so at the same time, I was also a psych major, and I happened to get a advisor that had me do a practicum for applied behavior analysis in my undergrad program. And so I did some training on the principles of ABA for that company, but it was still just like kind of dipping my toes in. And so then...
And where was this? Where were you in college?
Mankato State, Minnesota State University of Mankato.
Okay.
Yeah. So, and it was great. Like my advisor had a master's in psychology, understood a little bit about behavior analysis. And so when I applied to different programs to go on and get my master's, one of the programs I applied to happened to be North Dakota State University, where Ray Miltenberger was at during that time. And I was accepted as one of his students. And so to be honest, I didn't know who Ray was at the time, but that's okay, because he's not the kind of person who expects everybody just to know who he is and, hold doors open for him. He's a really great, approachable person. And he was so kind and gracious as my first year advisor. So I've got the great opportunity to work with him. And then I switched to working with a clinical psychologist for my second year at my master's program. And when I was done, I was a little like, well, what in the world do I do now? So I ended up receiving an opportunity to go and work in an ICF IDD in Tennessee as a behavior analyst. And what that is an intermediate care facility for adults with intellectual developmental disabilities. So it's like a long-term placement where there's residential housing, there's 24-hour staff. I ended up having the wonderful opportunity to work with some of the most severe residents at the facility. And I say it's wonderful because the opportunity allowed me to get really connected with not only the interdisciplinary process of collaborating with the treatment team, but also getting to connect with the family members who, struggle with having their loved one at an ICF IDD who has these severe behaviors that maybe, has 911 protocol within their treatment plan. So that was great. So it was really formative, but it was exhausting because I was dealing with severe behaviors all the time.
That's tough work. I've done a little bit of that stuff. Yeah.
Oh, have you?
Yeah.
Oh, wow.
Yeah.
I would love to hear about that. It was I'm sure you can totally understand, a very involved process. And at the same time, the facility I was at was under what's called a settlement agreement with the Department of Justice.
Yeah, let's get into this a little bit because I want to. Yeah. I don't think a lot of our some of our listeners may be knowledgeable of this, and some may not. And I think it's worth kind of pausing and explaining the significance of some of these events. So, yeah, if you can give us a little bit of history as these things go, that would be super.
Sure. So the state of Tennessee, prior to me coming on the scene in the early 2000s, had a lawsuit brought against their facilities for allegations that were substantiated of abuse, neglect, and exploitation. And in fact, I think it was 2020 or Dateline did an undercover story where they sent a journalist in who worked for several months as a staff, and they filmed the clients being abused by the staff members. And this became a national media story. And so I believe that was certainly part of the settlement agreement, or that information became part of the lawsuit. So every facility, I think there were 3 or 4 facilities across the state, had the option to either fight the lawsuit or settle and say, okay, we agree that we need to improve. And so the place that I was at ended up settling. And what that meant is that they were under close continual scrutiny from the federal government with regards to what they were doing that was wrong and how they needed to improve what they were doing. So for me, what that meant is at times we would have someone come in who would observe us administering ABA interventions. They would look over our plans. They would ask us a lot of questions. It was a lot of long nights and long days to prepare for that. But it was a wonderful learning experience for sure to see the intersection of law and services.
Yeah, so, I remember when I was finishing up at Auburn in the late 90s, I went to Nashville to interview for some jobs, and a lot of the stuff was kind of going down at the time, and I ultimately ended up taking a different job and living in Delaware instead. But I remember a lot of that. A lot of these services were being provided as a result of these kind of federal lawsuits and other types of kind of large-scale regulatory interventions.
Yes, yeah, it was and it wasn't just specific to Tennessee. It actually happened in Kentucky as well, and I'm sure other states for sure. But one of the things that was really good is that experience allowed me to help and become equipped to help the facility in Kentucky to work under their settlement agreement with the DOJ. And so that just meant training them to write plans that met their standards and working with the interdisciplinary teams to be more collaborative, to provide more integrated care. So after doing that for several years, I decided I wanted to move away from that facility-based care to more of a community setting. So I began to serve adults with IDD in the community in group homes. And again, just one of the most treasured times in my career. I just truly love working with adults with disabilities. They're wonderful people. It's just a great experience to be welcomed into their life and their world. But it was also very exhausting because I did end up having, again, a caseload that contained adults or severe behaviors and a lot of distinct heavy involved problems. And so after, I would say about 3 or 4 years, I decided to become certified as a BCBA because I didn't do it right out of school. And so because the nation was moving in this trend of requiring the certification, it felt like a good time. And after I was certified, I started to work with children with autism in the military through the benefit of TRICARE. And that, again, was another experience. Why I had experience doing that in grad school, doing it for a payer, like outside of the vacuum of grad school and the kind of predictable parameters, it was very different because it was a whole different dynamic set of rules. Just the whole process it took a bit for me to understand and learn about it.
Can I ask you a question real quick? So you went from this severe behavior population to children with autism. And I remember when I made a transition from working in a residential setting with individuals with these types of severe problem behaviors, like self-injury to the point of detaching retinas and, all sorts of things like that. Was there kind of like a cultural shift in terms of, because I remember when I started, went from there to like consulting in school districts, is I was kind of like, oh, well, so-and-so is aggressive. And I'm like, well, what do you mean by aggression? Oh, he pushed me, I'm like, oh, that's nothing. Did you have any kind of like, wow, I'm not in Kansas anymore type of moments in terms of just the severity and the different perspectives of what was problematic, at least as it relates to problem behavior?
Yes, I had to reframe what a problem was. And also, I found myself kind of scaling back my vigilance about what the families were experiencing, because I didn't realize that I had kind of functioned on a crisis mode per se for a bit, like coming in, what's the problem? How do we handle this? Like, what's the strategies? Go in and do our FA. And it was a different pace. So you're working with insurance, the pace is different, and then the interventions are certainly different. But why I am thankful, because I did encounter families with children who were younger that had severe behavior. And I felt for these families, I felt for all families for sure, but for them, there's a certain kind of isolation associated with having a child with severe behavior and not accessing resources that are equipped to support the family. So I felt like at least I could give them guidance in a way that maybe someone else hadn't yet. But that's a good question.
Yeah. So take us up to what you're doing these days, and I suppose we could probably transition into what the topic that we of key performance indicators.
Sure. So after working with children for a while across different states and going overseas and having opportunities to consult, those different experiences allowed me to end up with BlueSprig. And so BlueSprig is a company that serves children with autism. They're private equity backed, which I know is kind of a high topic of interest right now in our field.
That's very delicately stated, by the way. Well done.
Yes, I certainly understand it's a very sensitive topic. But prior to all of understanding BlueSprig and their values, one of the things that really drew me to the company was their model of just equipping clinicians, equipping employees, their outlook on what they wanted to do, what they want to do right now in the landscape of serving children with autism and people with disabilities in general. I found them to be really well prepared and values driven, and truly not only talking about a mission, but having the means to accomplish it, which was exciting. And so when I came to BlueSprig, I started out serving as what's called an area clinical director. And so that just means I had the opportunity to support several different clinics across different states and give them guidance about where they were going. And over time, they offered me the opportunity to serve as the director of clinical compliance, which means I get to work with a team of interdisciplinary subject matter experts, I would say, that take all the information that happens in our field when it comes to payers and contracting and policies and laws, and making sure that all of that aligns and is in compliance with those rules and affects positively what we're trying to do in terms of treatment outcomes and quality of services for families.
Great.
So,
yeah. So I assume that involves. So let's, I guess, turn to the topic at hand here, because I think this is going to be in talking about kind of what you do in this role is probably going to involve lots of key performance indicators. So let's kind of level the playing field. So for those who don't know what a KPI is, and again, that was a term I've heard bandied about. I just kind of thought it was kind of like MBA speak, so it wasn't something I paid a ton of attention to, at least in terms of the term itself. But just for the sake of folks who don't have a background in this, what is a key performance indicator?
So, great question. Before people, I want to just offer this caveat. Before diving into this conversation, it's okay to feel overwhelmed or kind of ill-equipped. I felt that, and I felt very intimidated, but also want to encourage your listeners. This is something that I think you'll find more second nature than you realize. So what a KPI is it's a performance measurement that helps the person or the company or the board or whoever it is understand how things are going within an identified area. So it's essentially a metric, a a unit of measurement. It's a data point, or could be several data points to tell you how you're doing when it comes to accomplishing your goal. So it's different than a goal, which when we think about goals as behavior analysts, we're thinking about it in terms of something that has criteria, that has a timeline, that has clarity about what is being accomplished. I want to kind of step away from that model and talk about goals more in the commercial sense, or more in the business world, where we're looking at bigger picture ideas. And KPIs help you understand how close you are to meeting your bigger picture ideas.
I see. And so when did this term come across your radar?
Within, I would say, week 2 of my onboarding with BlueSprig, I was on my meeting calendar, had an invite to go to a KPI. And so I didn't even know what that meant. And I just mostly sat watching, overwhelmed, and listening. And by watching, I mean, we had the meetings through Skype, business Skype. And what they did is they talked about all these different KPIs and what that meant for the for that clinic that week, and what it meant for decisions going forward about how we were strategically working towards our goals and our mission as a company. So it was a lot of note taking for quite a bit, I would say.
I want to tell you about an awesome training that's coming up. On April 16th and 17th, Dr. Greg Hanley, along with his outstanding team from FTF Behavioral Consulting, are putting on a 2-day workshop at the DCU Center in Worcester, Mass. At this workshop, you'll be introduced to the latest iteration of the practical functional assessment process that allows for the development of skills-based treatments, or SBTs as they call them. This is a hands-on workshop with lots of individualized attention from Greg and his colleagues. Attendees will leave the workshop with a fully designed, individualized ISCA and SBT for their client. In other words, attend this workshop on Thursday and Friday, and show up to work on Monday with a new repertoire of assessment and treatment skills. You'll also be provided with lots and lots of tools to make this job easier for you. You'll get sample scripts for caregivers and administrators, defining the rationale behind the PFA and SBT processes. You'll get samples of completed PFA and SBT workbooks and data sheets, as well as blank copies to take home with you. You'll get copies of completed PFA and SBT reports, along with suggested IEP goals, and you'll get Excel graph templates for the assessment and treatment analysis results. So again, this is a really awesome opportunity to up your game as it relates to the assessment and treatment of problem behavior. So if you want to learn more, go to ftfbc.com/events and get your ticket today. Again, that's ftfbc.com/events. I see. And tell me about, I know this is a term that's used in other fields, perhaps other healthcare settings and things like that. Can you talk about like what you've learned about this? I definitely want to get into some specific examples, and we'll certainly do that. But let's talk about how this terminology and the use of KPIs is something that's been happening for a while in other fields.
Yeah, that's a great question. So basically, KPIs, I think, are most commonly associated with the healthcare industry. So, as our field is more newer on the space of offering services within the model of healthcare, they've been doing this for quite a bit. And so when you look at healthcare in general, KPIs are really common for hospital settings or inpatient clinics, outpatient clinics, imaging centers. And the process is kind of a top-down process when it comes to articulating KPIs. So usually there'll be a decision made at the board level or at the ownership level, however that's defined, about the goals or the values or the mission or the purpose of the hospital or the clinic or whatever it is. And then they, from there, select, their goals, maybe their 3 to 5 goals, whatever it is, that cover maybe operations, or maybe it's something about the physical health or the quality of services. And then from those broad goals, they have individual KPIs, like how long it takes a patient to see a doctor, how many patients are seen in a single day, maybe how many claims are being paid correctly or how many claims are rejected, that kind of thing.
Okay, so these give you basically like what Aubrey Daniels might say. These are like pinpoints for business performance, basically.
Yes. Yep. Exactly. They're indicators to tell you how well you're doing in achieving your goal, for sure.
Great. So let's circle back then to the provision of services for individuals with autism. So if you can give us an idea about how you've seen, looking at the service delivery, I guess, flow or process through this particular lens has been helpful. So can you give us a couple of different examples about what sort of KPIs you guys are measuring and a variety of different touch points with across the service delivery?
Yeah, of course. So I like the word, that lens that you used. I kind of want to give a caveat about talking about KPIs within the field of ABA. So it's so important to remember that if you're providing payer-based services, that you uphold your contractual obligation, and that obligation includes providing medically necessary treatment. And what can happen with KPIs is that lens or that framework can kind of get shifted off to the side and become more distant, and the number itself becomes the emphasis, not the means. So focusing on the number of billable hours, and that becomes the point, versus looking at an authorization as a request derived from an individualized evidence-based assessment pertaining to medical necessity. So I guess I just want to couch the weight of this responsibility with our obligation to make sure that this is all done with our understanding of the medically necessary model, as well as our obligation to the payer. And that helps keep people's perspectives in line with where they're going and what they want to do. So we can kind of maybe start at the top of the process. So the process would be, first of all, to select goals, and those goals then determine what KPIs you look into. So usually for a business, or usually for an ABA company, a goal might be for them to provide efficient services. So, and that's a really broad goal, but I'm just trying to speak off the top of my head. So
Sure.
Let's say they want to provide services that are efficient, so families are getting access to services as soon as possible. So that might mean that you're looking at for assessments, for example, how many days it takes you from the initial referral that's made to write the assessment, to get the parents' approval, and to get the insurance to sign off on it or to approve it. Or it might mean that you track how many units you're using to build the assessment versus what was authorized to do the assessment. And that's important because as we're delivering services in the early stages of being on the landscape in the field of autism, we are writing the history books on what ABA should look like for our payers. And so one of the cases that people always make about insurances that don't, or benefits that don't offer enough coverage for a certain service, like writing assessments, is that it takes far longer than the units that we give. But we also have to make sure that we're documenting and using what they give us so that we can make the case if the opportunity arises for requesting more time. And that ties into providing efficient services, because if we get the right amount of hours authorized to conduct an assessment, that allows us to be able to support the fiscal health of the clinic so that we can continue to work with the family in an efficient way. Does that make sense? I feel like it's very circular and intertwined.
Yeah. I do most of my work consulting directly with schools, so the authorization piece, I'm familiar with it kind of peripherally. I've done a little bit of work in some clinics, just kind of most recently filling in for a colleague who's on maternity leave. So I have a little bit of connection with that line of work, but so, and I know enough about it to know, like, I don't want anything to do with, like, or I hear people that just kind of complain about the authorizations and things like that. So, so anything that would help, I guess, advocate for or build the case for, additional or appropriate amount of assessment hours and things like that, I think would be helpful. So that was a very interesting explanation. And I love the term that you used, or the phrase of we're writing the history book of, ABA service provision. I'm paraphrasing slightly, but I think that's one of the reasons why I just love doing this podcast, because I feel like that is just, one of many different things that we're seeing in this field right now. Is it's basically exploding before our very eyes, in terms of it's the number of certificates and the number of individuals receiving services and things like that. So I think that's a very interesting and appropriate phrase in terms of how that works.
Oh, well, yeah. I mean, I appreciate your understanding of the topic, because as the field continues to be impacted by all these outside variables, it can be really easy to look to the left or to the right, and then there's that drift from the core tenets of our science or the core principles, the core 7 dimensions of our field, right? And so, I certainly don't want to be on a soapbox too much, but
please. This is what this is all about. Yeah.
One of the things that really, I think for me, especially in the last year, that has been clear and is one of the more chronic problems, in my opinion, with the challenges between payers and providers, is there is a drift from the application of our 7 dimensions within our daily practice. So maybe plans are not as socially significant as they could or should be, because we're so focused on getting the assessment done as quickly as possible to get services going to help the family. Or maybe a provider is writing a plan and thinks that they're dictating one outcome, but actually, if you look through the lens of technological, when we talk about our 7 dimensions, you're seeing that they're writing something, they're meaning one thing, but being literal, it's actually producing a different outcome.
What would be an example of that?
Yeah. So, like, let's say in a goal, there are 2 behaviors tied together in a goal. And let's say there's no evidence, and by evidence I mean no data, nothing in the assessment to reflect that prerequisite skills have been assessed, or that both of those skills that are tied together in a single goal have been first demonstrated in isolation with mastery or generalization or maintenance, but instead they're pulling skills together, and then they're measuring it as a percentage of occurrence. So let's say the goal is a child will take a sip of water and say hi with independence 90% of opportunities for 3 consecutive sessions, right? So it's 2 behaviors, 1 goal. So then when you have your data point is, let's say it's 65% for a given date. What you don't know is, did they only do 65% of that opportunity? Did they fail because they didn't take a sip of water independently? Did they fail because they didn't say hi with independence? And so I'm not sure what a person would convey to the parent, but let's say that they're saying, yeah, the child is doing they're at 65% with this goal, but it's really hard to say what exactly that is. But I think sometimes there's just that piece is missed because there's that drift from being technological or even behavioral, right? Like looking at a baseline, looking at the intervention, looking at the treatment effects, looking at graphs, looking at data. One of the things that I find to be really interesting, especially on social media, but people will send emails as well, is questions about, does this payer require graphs, or does this payer require graphs for, parent goals? And my response is, off the top of my head, maybe I know or don't know, but I know what our code says. Our code says behavior analysts are supposed to make database decisions using graphs to interpret their clinical decision making. So, we're delivering services on the basis of our certification or our licensure. In most states, not all, but most states have absorbed the code into their laws governing licensure. So essentially, if you're licensed in a state that does that by law, you would have to be demonstrating database decision making, whether or not the payer requires it.
Right. So the question is should have answered itself, right?
Yeah. Exactly. Yep.
Yeah.
So
go ahead.
That's what. That's just kind of like what I'm talking about in terms of like the drift and the distractions. And this isn't. I hope no one is discouraged by this, because I'm a provider. I understand there's the voices of the payer, there's the voices of your timeline, your employer. I mean, there are a lot of obligations that you have to meet in any single interaction with service delivery with a client. But that's why it's so important, because we are writing the history books, to do it well and to do it right, so that we're not having to fight through additional regulations or red tape that comes in as a result of poor compliance with just the basic rules.
Got it. Yeah. So we talked about using KPIs, I guess, to look at the authorization process. We touched on like billable hours, and perhaps that's something we can come back to in a minute, because obviously the hyper focus on that or the over focus on that can lead to all sorts of deleterious outcomes. But I want to talk about how you're using KPIs and other facets of service delivery. So there's a couple of different areas that I was just curious about. And if there's more about the assessment and authorization process, by all means, fill in those blanks. But I'm also thinking like in terms of staff training, staff onboarding, performance management, things in that area. Can you talk about how you can use this lens to improve performance in those areas?
Sure. I'll first kind of go back to just giving some additional suggestions about potential KPIs that you could look at through the authorization period, because from start to finish, there are plenty of opportunities to pull in KPIs to help support your decision making about whether or not you're achieving your goals, whatever it is, or if you need to re-look at your strategy and kind of realign your strategic plan. So when it comes to authorizations, for example, one of the things that is really important right now for providers is being accountable to the payer about the request that they've submitted regarding treatment hours. So there's certainly the framework of requesting what is medically necessary, but then there's the reality of the child's life, which is their schedule and their availability. And what is medically necessary may not always align with their availability. Often it actually doesn't. So there needs to be some kind of documentation or accounting for that to the payer. But it also is a good KPI to help you understand several things, like, are you accurate? Maybe if you're requesting 40 hours and let's say the child's only available for 30 and they're making excellent gains, maybe they medically only require 30 hours. Maybe you need to readjust what you've been requesting for the child. Or let's say they are only available for 20 of the 30 hours and they're not doing well whatsoever. That might be your data point to help you demonstrate that they actually do need the full 30. And then you work with the payer and the family to try and get them to that point. Another one is looking at the total treatment hours that are used compared to how far you are in the timeline of their authorization. So some payers will allow you to pull hours from a bucket, so to speak, where even if you've requested hours per week or hours per month, however the auth is written, if the child is gone for 3 weeks, you might be able to make up, so to speak, some of that time later in their authorization. So measuring the child's progress through the timeline of their authorization is also really important. So you're being accountable for how they're doing based on what you've requested for services. But that's kind of like the treatment aspect of it. And I know you mentioned performance measurement of the staff. So this, again, is dependent on your goals for this area. But let's say one of the things that you're really focused on is quality of services and parent satisfaction with the customer experience that they have. So maybe you can develop a parent satisfaction survey that everybody receives within that clinic, all the families receive. And then that score becomes a KPI to start looking at to see how far you are with your goal of getting satisfaction or quality services. Or maybe it's difficulties with staff being happy, or maybe there's retention issues. So you could look at the number of days that staff are arriving on time or the number of days they're arriving late, and how they're doing in terms of the timeliness of their services or their documentation. So maybe you have all staff write their session notes on the day the service is rendered, which is what is clinically appropriate, but maybe some are struggling and are doing it a couple days later. So that might be a KPI to look at to improve staff performance with documentation. And then, I know that you talked a little bit about client outcomes, why you certainly can use KPIs to measure clinical outcomes. This is kind of also delving into the model of value-based care. Are you familiar with that?
Is it? No, I can't recall hearing that term specifically. Obviously, the individual words make sense to me, but but go ahead, tell me what value-based care means in the context in which you're referring to it as.
Sure. So value-based care is very similar to, that model is very similar to KPIs in the sense that it's been around in the healthcare industry for quite a while. It's really commonplace in hospital settings. Hospitals are really using this. And what that model does is it does look at clinical outcomes as a way to reinforce, if they're good, the practitioner or the provider, the doctor, and if they're not doing well, to also readjust that plan as it pertains to the practitioner, the doctor, the provider. So the better that the client is doing, so if they're on a regimented treatment and they respond faster than expected, that saves the insurance money, right? And then it also, the doctor can be reinforced for that because they're doing the treatment better maybe than anticipated.
Would that be through some sort of bonus or something like that, or some performance-based incentive?
Yeah. So it'd be some kind of performance-based pay. And the reason why I bring that up is so it does look a little bit at clinical outcomes, so it has that theme in there, but it also is something that is coming to our field. It's not when, it's if. Even, goodness, I think it was in 2017 or 2018, this is something that TRICARE was also looking at. And I think there's potential for them to, not just TRICARE, but other health insurance companies to consider incorporating this model for the services associated with applied behavior analysis for children with autism. And if your listeners want to learn more about that, I know that CASP, the Council of Autism Service Providers, is having a webinar later in February. I think it's like on the 18th. It's on their website, and it talks about value-based care. And so they can go there, and I think you have to create a login, but it might be one that they would want to listen to learn more.
I see. Okay. Are those processes things you're already putting into place at BlueSprig? In terms of I'm particularly interested in, the performance-based incentives, based on client outcomes for, I guess, would that be for the individual BCBAs? Do you have, I don't know, pardon my French, but do you have like a kick-ass BCBA? Are they earning more relative to, the average one, based off of the client outcomes and things like that, or how, and I don't want you to kind of divulge, I guess, personnel practices that you're not comfortable divulging, of course. So in many respects, I realize I'm kind of putting you on the spot here, but can you talk a little bit about how that might work, at least from examples that you guys have at BlueSprig?
Yeah, that's a great question. We haven't adopted a value-based care model for our BCBAs, but we are looking at client outcomes. And I think this is something that I would encourage all of your listeners to look at client outcomes as a provider of services for a lot of reasons. For any of those that are listening that are TRICARE providers, this probably was one of the most well-known topics when it comes to understanding outcomes. So TRICARE, at the request of Congress, is sending them on a quarterly basis results from outcome measures that they have required providers to use to demonstrate whether or not ABA services are effective for children with autism who are in the military or whose parents are in the military. And so there are other health insurances that mandate the use of certain tools, and they use that data to evaluate whether or not treatment is having its intended effect. The challenge is that, well, there's a lot of challenges, but it's really important to make sure that when you have these large sets of data from outcomes, that you're interpreting it properly within the right lens and that you're understanding the context as well. So like making sure that providers are understanding what they're administering and making sure that the data is being interpreted according to the guidance from the manual of the book. And then looking at the significance of that data in a way that's clinically appropriate instead of making like leaps or implications. And I'm not saying that anybody's doing this, but there's that risk associated with interpretation of data if you're not fluent in the tool itself. So when it comes to outcomes with BlueSprig, we are definitely looking at, are we doing what we say we're doing? So, we're saying that a client is making progress on their goals, but is the progress really what we think it is, or is it something different? And so by that, we look at using consistent tools. We haven't fully rolled the whole process out yet, but that is something that we are doing in order to make sure that we're holding ourselves accountable to the families that we're serving as well.
Are you in need of continuing education? Well, Behavior University is a BACB approved continuing ed provider, and their mission is to provide university quality courses and ABA for new and experienced professionals alike. Their live webinars generally have a limited number of attendees so that the learning experience is highly interactive. And if you can't make the live events, these webinars are recorded and available in Behavior University's CEU library for later viewing. Behavior University also has a 40-hour RBT training. This self-paced course uses a combination of visual presentation, audio lectures, and live video models to teach all areas of the RBT task list. The course is accessible anytime and from anywhere. So if you'd like to learn more, head on over to behavioruniversity.com/observations, where you'll find a 10% discount for podcast listeners. Again, that's behavioruniversity.com/observations, and thanks for checking them out. I see. And what tools are you using to measure client outcomes?
So one of the ones that we'll be using for sure is the Vineland 3. And then another one is the LAPD, the Learning Assessment Development Profile, I believe it is. And there's one more. Goodness, and it's one that looks at kind of like the parent component as well. But I cannot, it's slipping me. So I'm going to blame it on only 1.5 cups of coffee. So sorry.
That's right. We are recording this like you're in Central Time, so it's even earlier for you. So we got on this Skype call at 7 a.m. Eastern Time. So I'll tell you what, why don't you, when you remember it later on today, whatever, just email it to me and I'll make sure it goes in the show notes. And
Sure.
So we can have people go to behavioralobservations.com and look up your episode, and we can put it in there.
Sounds great. Yeah. one of the other things that I was going to talk about too, that you had mentioned before, is like understanding how to use KPIs to evaluate the fiscal health of a clinic. So if you don't mind, I can give some suggestions on what that could be for a provider.
Yeah, I would love to. I know personally a lot of kind of small clinic owners in my little neck of the woods here in northern New England, and I know a lot of folks in the kind of ABA business builders community will definitely benefit from this. So yeah, by all means, go right ahead.
Sure. I should say too, like, one of the things that I'm so thankful for when it comes to BlueSprig is their perspective on supporting clinicians and taking ownership of the clinic itself from a fiscal perspective. So I don't know about you, but when I was in grad school and I got my first job, to me, money was something that was out there in a cloud somewhere, and I would do my work and put my head down, and then I would get a paycheck. Mm-hmm. But understanding the back end of overhead for a practice, or what an insurance company is paying versus what you're billing, or issues with claims that are being rejected or money that's being recouped, all of that really does impact a clinic's ability to provide sustainable services. So if that's one of your goals, to provide sustainable services, some KPIs to look at would be how many dollars you're billing per day or per week or per month or per year. So understanding the total amount that in revenue, the gross amount that you're billing out, but then also looking at, of those claims that you're sending out, how many are actually being paid. So there's, just because you are billing doesn't mean you're going to get a paycheck for what you're billing. Looking at how many dollars you're spending per day or per week or per month on your employees, whether it's paying them the insurance rate or paying them for time that's not billable to the insurance, and calculating that out for every employee, no matter what their category is. And then also looking at the cost of doing business. So per day, per week, per month, per year, however you want to look at it, but understanding really what, given your cash flow, can you afford to continue? Or is it something where you might have to restructure something within your company or your clinic to make sure that you can afford to continue to provide services?
Are there any software tools that help you guys look at these factors? I can imagine, especially from the standpoint or perspective of a small practice owner, there's just so much information coming in, and it's very likely difficult to make heads or tails of it. And so I would imagine there might be some tools out there that could be helpful. But has there been anything that you guys have seen that helps kind of sort this stuff out? Maybe answer some of these questions in terms of especially stuff like cash flow and billable versus non-billable hours.
Yeah, so BlueSprig developed a dashboard, which that was something that I completely missed, is KPIs are most easily viewed on a dashboard. And then, dashboard is, what I'm saying is what hopefully most people are understanding it. It's a common term for like the back end of a software business, or, if you have a profile within a website or a company, mm-hmm. It's a way to compartmentalize that information. So, BlueSprig has developed their own organic dashboard that synthesizes all of this data into the different categories. So it's not something that anybody outside of BlueSprig could access. But I don't want people to be discouraged. You can do you can do this yourself. You can use QuickBooks to develop profit and loss statements, or you can do like what I did as a sole provider, just track all these items on different spreadsheets to give you an understanding of what you're looking at. It's a little bit more labor intensive, but it's necessary if you want to do what you think you're doing.
I see. Yeah, and like so many things, it's the little things that are spending that little bit of labor. It probably yields larger benefits down the road for sure.
Yes, absolutely.
Wow, this is a great kind of 101 with this stuff. So I appreciate you kind of walking us through this and kind of answering all my uninformed questions here. So Before we go, I wanna ask a couple more questions here. I got one question in from Andrew, and I thought this question was great. And I think some of these things you touched on already, but what are measures that you're using for social validity? Do you have a KPI for social validity? I think is what the question boils down to. And if so, how do you measure it, and what do you do with those data once you have them, and what are some changes that you've made, perhaps based on the outcomes of those assessments?
Yeah. Oh, that's big questions. Good questions. So when it comes to looking at social validity, I think it's important to remember that you can't always standardize understanding individual preferences, because that's the heart of, that's counterintuitive to individual preferences, but you can look at overarching themes that pertain to parent satisfaction with services. Is treatment having the effect that they hoped it would have? Are their needs being met in terms of the reason why they came to get services in the first place? If a family wants their child to learn to be independent with, daily living skills, but all of a sudden they learn to fly a plane, is that relevant for them, right? So looking at that through parent surveys, and then based on the responses or what the data looks at, making adjustments. So maybe the adjustments is improving training for the clinician. Maybe it's encouraging the parents to participate as much as possible in training sessions to help them generalize the skills they're learning so that they can feel more confident with their child outside of services at home when it comes to handling problem behaviors. And then also looking at what if treatment is going in the way that they want it to go going forward. So continuing to get their buy-in so that as long as the child has not met their goals and they're not, ready for discharge, making sure that it's progressing according to what they have asked for from the onset of services. And then you asked a couple other questions after. Sorry.
So what is there a particular? Does BlueSprig have an internal survey or something like how do you measure these things? Or do you use something that's kind of more commonly available? And then so that's I think the other thing embedded in Andrew's question.
Sure. We don't use a standard survey to measure social validity, but if you look at, I'm sure that there are some out there. I don't know anything off the top of my head, but I would encourage Andrew or anybody that's interested to make sure that they can research social validity tools out there, but individualize what you're making according to your family's needs, because a pre-existing tool might address things outside the value system of your client base. Culture, community, region, location, all of those things tie into social validity. And so a tool might not capture all of those variables that contribute to a robust score.
I see. Okay, very good. So you mentioned the CAST webinar coming up, and we'll put a link to that in the show notes, of course. If there's are there other resources that you could suggest for folks to learn more about this if they're listening to this podcast and say, gosh, I really want to get more up to speed with this topic?
Yeah. So there are not a lot of resources actually. At APBA this year, though, Charna Mintz, who's the current president of APBA, is going to be on a panel, and she'll be talking about KPIs. And then later in the year, BlueSprig will be having an event in Houston for providers, and we're looking at potentially even making it accessible via the internet. And we'll be talking about KPIs at that event as well.
All right, very good. If that event does become open to the public, let me know, and we'll certainly share it here on the podcast. So, all right, very good. So I think this has been a great kind of KPI 101. I appreciate you again kind of walking us through this and making the case for why using this lens is helpful. So, all right, so let's close out the show. What advice do you have, Rebecca, for the newly minted BCBA?
That's a great question. So newly minted or seasoned, I would say as great as your confidence is as a BCBA, let your humility be the only thing that is greater. Whether it's humility with parents because they are the first and foremost experts for their children. That's one of my favorite quotes from Peter Gerhardt. Humility with clients, remembering that you have no idea what it's like to live even 1 hour in their life or their shoes, to see them as a person first. And humility with colleagues, like we have such a competitive field, but be collaborative. If they're doing well, cheer them on. And if they fail, then give them grace as your first response. And then also humility with others that you see as greater than yourselves. So, be really, really good at asking questions and even better at listening.
All right. I couldn't agree more with all of those points. So, all right, Rebecca, thank you so much for joining me today.
Thank you so much for having me. You are just so kind, and I appreciate talking with you. This has been a great opportunity.
Thanks.
Thank you for listening to the Behavioral Observations Podcast with Matt Sikoria. You can find Matt's notes on this episode at www.behavioralobservations.com. We also invite you to stay connected with us on Facebook at facebook.com/behavioral observations and on Twitter at Behavior Podcast.